By request of the meeting organizer, this meeting is being recorded.
Welcome to our December 16th Enddisparities Learning Exchange office hours entitled ShareLab and Abstracts. One of the things we normally like to do at the outset of our calls is just to have folks introduce themselves in the chat room, but we have a very tight-knit group today. So I thought maybe we could just share on the line a little bit about who we are and what we're trying to gain from today's discussion. That way we have a better sense of what's in store. I'll start. I'm Michael Hager. I'm with the National Quality Center. We're based in New York, and I'm the Manager of Technical Assistance and Dissemination. I'm also the lead of the Enddisparities Learning Exchange. And what I'm hoping to get out of the discussion today is some folks who are excited about ShareLab and interested in sharing their work and potentially taking it to the next level with an abstract and thinking about presentation of this work and conferences and beyond. Judy?
Hi, I'm Judy Popkin. I'm the National Quality Center coach for Florida and Georgia. I've been with NQC almost 5 years, and I see a familiar face or two on the screen. Hi. And I have used ShareLab, and I would like to share a little bit of my experience with navigating with you guys, and just a wealth of information there. So this should be a good discussion, and surely provide information that you can bring back to your team.
Thanks, Judy. Go ahead, Emily.
Hi, everyone. My name is Emily, and I'm the Program Fellow here at NQC. I've sort of been helping out Michael as his right-hand woman on the Enddisparities Learning Exchange. And so I'm just here to help out with the webinar, make sure everything runs smoothly. If you have any questions, feel free to message me in the chat room or just, call on me. So yeah, glad to be here.
Thanks, Emily. Laura, go ahead.
Hi, my name is Laura Berklew. I'm from Indianapolis. The organization I'm with is the State Department of Health, so Indiana State Department of Health. I am the quality manager here at ISDH, so we're just starting up our quality management program here. So I want to learn more about how to use ShareLab, because like I said, I looked at ShareLab, but I haven't really done anything with it, so I'm interested in learning about that.
Awesome. Welcome, and thank you. Robert, go ahead and introduce yourself, my friend, and welcome.
I'm Robert Bobo. I'm from Community Aid Network of, all over the state. I'm here really to support Judy. Hi, Judy.
Hi. Thank you for your support.
Great. And
as always.
And I'm the QA/QI specialist for Community Aid Network, 24 sites throughout the state.
Great. Thanks. It's great to have you on the line, Robert. And last but not least, I see that our federal partner, Shep Maritime, has joined us. Welcome, Shep.
Thank you very much, Michael. Can you hear me?
Yes, ma'am. Hi.
Okay, good. Thank you. Hi, I'm Shep Maritime. For those who've not met me yet, I am replacing Emily, who had been on this project from HAB. And again, I would say I'm still new, and I'm still learning a whole lot. So it's been very exciting just learning what happens outside the hospital, because I have been in the hospital for a few years, and I just got out recently. But it's good to learn about quality and what great things are happening in the community. Thank you for inviting me, Michael.
Absolutely. Thank you so much for joining us. And, Shep, I think that with your experience doing QI in a large hospital setting in Baltimore, I think it would be really cool if you have any questions or insights or anything along the lines of ShareLab or along the lines of, kind of pulling your QI work together for professional presentation at a conference using an abstract or another form. I'm interested in your feedback today, too. So thanks.
Thank you.
Great. So I'll move along. For those who are on this call, I know that you're all familiar with this, but for the benefit of those who might be tuning in later, the Enddisparities Exchange is a 9-month learning initiative that promotes the application of improvement strategies and interventions that reduce HIV-related disparities in 4 key subpopulations while building and sustaining a community of learners among the Ryan White HIV/AIDS program recipient community. The Learning Exchange offers informational opportunities like this one by content experts and by folks in the field, and we utilize the power of peer learning to facilitate local improvement efforts on eliminating HIV and related disparities. If you haven't had a chance to check out the Enddisparities Learning Exchange video, we strongly recommend that you do so. It's accessible on our website, enddisparities.exchange.org, and also on our YouTube channel, youtube.com/National Quality Center. It highlights many of the reasons why we're here focused on ending disparities in HIV health outcomes, and is a wonderful way to really energize your staff and other stakeholders around this important topic. So office hours are one of our types of educational opportunities. It's an informal discussion that we want folks to come together to interact with each other. We don't really have any slides. We'll go ahead and navigate around the web and do some clicks and pokes and whatnot that are relevant to the discussion and important to you. The office hours always occur on Fridays at 1 p.m., but not every Friday. It's a variable schedule, so we ask you to look at our website, enddisparities.exchange.org, and click Events. No registration is required, and these calls are open to everyone, regardless of their role or level of participation in a Ryan White HIV/AIDS program recipient agency. And today's topic is NQC ShareLab and Learning Exchange abstracts. So at this time, I'd like to turn it over to Judy Popkin. As Judy mentioned, she's one of our main NQC coaches. She focuses on Florida and Georgia and has a wealth of experience thinking about peer learning and about leveraging different types of tools to share information and to grow together. I think that Judy was new to ShareLab when she started with us, and so, it's been really neat to interact with Judy as she's, applied her expertise in working with others and helped us to refine this product and, is continually providing us with supportive feedback on how we can be better. So thank you so much, and Judy, take it away.
Thank you, Michael. And I will also mention, just like Shep, I came from the hospital industry, and for over 25 years, I worked in hospital settings, and one of the things that I found most useful, especially working when I did work in the hospital system, was sharing and peer interaction. And by virtue of the multi-state system that I was in, we had monthly conference calls, and we also did have a repository of ideas and projects that people have done, because like NQC, we didn't want to have people reinventing the wheel. So when we could provide a resource or a tool or a template, we found it very useful, was not a competitive environment. So that's what I love about ShareLab and its availability for everybody. And for those of you who are not familiar, the definition of it is a virtual exchange for sharing your quality improvement interventions and spreading innovative ideas amongst individuals working in the Ryan White community. So it's there basically as a repository, a library, if you will, and the way it's set up is very user-friendly. You're able to drill down on a topic. If a topic or intervention that's been submitted covers more than one key area, it will be included several times so that people won't miss out being able to find what they're looking to drill down upon. There's basically 3 main areas to ShareLab. There's the search navigation area where you surf through the improvement strategies posted. You create a user profile, and that just allows you to partake. And again, like Michael said, you can do that without necessarily being in a Ryan White program either. And it gives you more than that, a way to enter improvement strategy information that has been successful, or even some that may have proposed, shown barriers or problems, so that other people can learn from your ideas and experiences. If we want to navigate, this is what the main page looks like. And you can see on the top there's an area to register and to log in, and a couple of symbols that are at the top of the page, and the little clock, it's kind of hard to see, but the little clock thing, emoji if you will, basically helps list out the most recent entries into ShareLab. So you were looking at the most current information available in the database. And the other one is like a little flame, basically is an indicator for favorites. And together, I believe Michael, you can back me up on this, but together between those two built-in configurations, when you do click on a blue box, a blue node, for instance, it will automatically pull up the top 5 examples.
Yeah, that's right, Judy. So when we're engaging with the system, and we'll be showing you a little bit some of the tips and tricks of the system in a few moments, it aggregates all of the different likes that are for each post, so that the ones that receive the most likes are here. And we can also drill down to see where we have the 5 top-rated interventions. So, you know, with this one, there's only one listed because there's only one intervention there. And since there's 31 here, we've only shown the top 5. And you can get the full list by clicking activation.
Okay, and that's a really good-looking screen, and basically each of those rectangular boxes and the little colorful box at the beginning indicates a different strategy or intervention that's been added, and each one is assigned a number. So I'm pretty sure that if you go into the search box, if you know the number for the intervention that you're looking for, you may be able to search by that number as well.
You know, we've had some people ask us, Judy, what the heck are those numbers for? And to be honest, the In Care campaign collected a large number of interventions all at the same time, and we needed a way to kind of organize them for our own purposes, but also so that we could communicate about them. And this project actually sprung up out of the In Care campaign. So we were in one of those situations where we had just the name of an agency, but not the name of an intervention. So you can see that Gurabo has submitted several. So has Centro. You know, so this is a way to make sure that we are capturing, you know, retrospectively different interventions, but we didn't have an intervention name. You'll see that as you work your way through, the new interventions that people are entering don't have the number, and you don't have to have a number to enter an intervention.
Okay. So I have a question for you. If an organization, let's say their quality management person or their program administrator or project officer wants to see if an organization has submitted anything, can they enter that organization's name and find out?
Yep. So when you do a search,
that's another way to start.
Yeah.
Go ahead.
When you do a search, the search is looking across all of the different fields that we have within ShareLab. And it should be noted that there are many different levels of use. And I haven't even logged in yet, but I'm still able to search, and I'm able to view and manipulate this tree. As Judy mentioned, there's a number of different ways to access the information. We can click to drill down this way, or we can do a search. And there's other ways that we can go too by clicking on recent and popular that Judy has already mentioned. And we're able to interact with and view interventions even without logging in, and we don't even need a login to do that.
That's a great feature. And again, I'm very visually oriented, so I love using the tree personally because it allows me to really look at the depth of digging that folks have done in their interventions and look to see how many kind of cross barriers in terms of what they do and so forth. So another great feature about this is that you have the contact information for the person that has put in the intervention. They can choose not to provide their specific contact information, but more likely than not, you'll be able to find someone that's associated with the intervention and use them as a resource. And that's one of the other things about spreading peer knowledge and innovation is that you're not just reading a little abstract that's been put in from, some journal somewhere where the author is, 90 steps removed. You're able to really get one-on-one interaction with the author and subsequently even follow up with any additional posts that they may have put to supplement what they originally put in, because as you know, with these cycles, with PDSA and things changing all the time, sometimes we tweak what we're doing and it works even better, and sometimes we just work to eliminate one or two of the barriers or challenges that existed, and those simple changes really make a big impact. So it allows you to think, and when you bring these little abstracts to your QM committee, because you're working on a similar topic, they also tend to stimulate conversation about, hey, why don't we try this, and we could try that. Has anybody used ShareLab in this manner or had any experience with actually pulling something up and printing it for a reason? Well, then that's your assignment. I'm kidding. But again, that is a good way to not only educate yourself, but to stimulate peer learning and conversations. And now we're back to the tree symbol. And as Michael mentioned, there's a grand total of over 700 different interventions that are cataloged. And they went through an awful lot of trouble to figure out some of these main categories, as you see, and then as you pick one of the categories and click on it, the blue node further breaks down into specifics. So you can really drill down to an area that you're interested in and see what those interventions are. So if you want to pick a topic, or just click on something, you'll see. And there again, substance use, crosses barriers, but there's 5 different selections that you can look through and see if anything strikes, a feeling within you that you need to try that intervention out. So,
Judy, one thing that I'd like to say about this is that I really like the way ShareLab is designed so that when you're in an intervention, you can follow it down the rabbit hole in whatever way that you're interested. So let's say that in reading this post by the Broward EMA, I'm really interested in seeing more around how revising client-level outcomes and indicators for Lex services, is something that's on the administrative side that I can give to one part of the team that might not be dealing directly with patients. And I can think about whether or not whether or not I want to kind of explore some more of that. So if I wanted to explore some more of that, maybe what I would do is go click on patient tracking, and it'll pull me all of the patient tracking related interventions. So this way I can continue to pick through and to find things that are like what initially interested me. You know, and so it's easy to go and follow through the rabbit hole each of these different interventions and how they're interrelated. I also want to point out that when you're on any of these pages, even when you're not logged in, you can print, as Judy mentioned, to bring into a committee, or you can also share. If you want, you can generate an email, you know, that has a link to it. You can post it on Facebook if you're that excited about it.
Wow. I did not know that.
And you can tweet about it. So there's a number of different ways that, you know, whether you're a registered user or not, you can share this information with members of your team, with folks that are part of your stakeholder group. If you're thinking about this from a consumer perspective and you're looking to get some of your brothers and sisters excited around this work that's happening at a certain clinic, or you're trying to bring that work into your own clinic, I think that this type of sharing, you know, through social media and through email and other, you know, methods such as printing is a great way to share and to leverage this resource.
Michael, the 5 keywords that are posted at the top of each intervention, are those for new submissions, are those identified now that the basic library had already been put together, are those identified by the submitter of the new intervention?
Yeah, absolutely. And I think that what we should do is probably walk through an example and check it out.
Okie doke.
Yeah, but yeah, the categories themselves, these bubbles, and the same bubbles that you see on the top of this page are set by us administratively, but these are set by users who are making entries. And I think Judy mentioned, but just a little spoiler, that you can download the instructions very easily right off of the home page. So this is something.
And the instructions are very explicit. They're color-coded. They really have good diagrams to help you walk through the process. So if you're introducing ShareLab to your team and using a PowerPoint, this makes perfect slide sets, or you can just copy it, about 12 pages, I think, and distribute it if you really want people to come back with some ideas that they feel might be doable in your agency.
So maybe something that before we do a practice entry, just to kind of make folks feel comfortable about registration. Registration is, I think, pretty easy and straightforward. Church Street, 13th floor, New York, New York. Okay,
and this is so that it will subsequently appear if you make a submission, if you provide a submission, or it's just for administrative purposes?
It's for both. And you'll see that when we get to, by the time we get to entering, that there are ways that you can make sure that your data stays private if you want it to stay private.
Correct. Okay.
So here you can see that I am filling this out on behalf of the AIDS Institute, which the National Quality Center is actually part of the New York State Department of Health. Great. and then you click agree, and then register, and that's literally all it is. You saw me do it in less than a minute. So that's something to keep in mind. That it's very easy to do. And of course, we have the instructions, and of course, I'm here to answer questions, and our folks like Judy are available to answer questions too. But let's log in. I'll log in using my central NQC password. So we can see here that when you log in, it takes you to your main navigation page. So here's my profile information for what I had set up previously. Here is a chance to edit my profile. These are the folks that I said that I was following. These are the folks who are following me. By the way, following is similar to any other social media, so that if someone's following me, they receive an email every time I make a new entry. If I'm following someone else, I receive an email every time they make a new entry. So it's really neat that, you know, you're interested in someone's work in particular. You can follow them within the system and be kept up to date whenever they make new posts or comments. Here you can see our posts. These are actually invisible because they are tests, and since I'm a central admin, I can see tests. But, you know, for other folks, as you make posts, you'll end up being able to see all the different posts that you make, including comments to others. This is a comment to the Broward EMA.
So, Michael, if you do select someone to follow, or conversely, if they select you, it's really in relation to that particular intervention. You won't necessarily get email if, let's say, they're making 10 other entries. You won't necessarily get 10 emails announcing that. Am I correct?
No, actually, if I like a post, anything that happens with that post, I'll be notified. But other stuff that those users do, I won't be notified. If I'm following a user, anything that happens with their post activities, I follow. So if I followed someone and then they went ahead and made 10 new entries, I would receive 10 emails saying, hey, someone made an entry.
So that's great. So if you like and respect an organization's work and you know historically that everything they do is super or of interest to you because you have like or similar programs, then, you know, it's like getting a little bonus email to let you know that there's something new.
That's right. I just want to show two other things since we have additional symbols at the top once I logged in. We can navigate to my favorites and we can navigate to my entries at the top very easily as well without being within the profile itself. So I don't know if anyone has any questions or if there's any particular feature that you want to see first before we go through and make a test entry.
Does anybody have some suggestions for the types of information that should go in? What you as end users would like to see? Because I don't believe there's a template that must be followed. When you read these different interventions, some of them are written slightly differently than others. And I think what Mike's doing here is going to take an intervention from our Enddisparities Learning Exchange and place that into ShareLab.
So we can see that transgender doesn't have any. So let's go ahead and enter one. See if I can pull this up higher. All right. So transgender linkage to care program. So we're going to say transgender linkage to care program.
And that's the entry title for those who are just listening on the phone.
So keywords should be transgender, retention,
disparity,
disparity, hormone, affirming,
maybe even cultural competency or something like that.
competency. I'll say cultural competency.
Yeah.
Then keywords, again, are completely driven by users. So anything that you write is the right answer. There's no wrong answers there. And then it'll link automatically to other entries that have similar keywords. So this is a very simple intervention. Gender affirming care has an association with better outcomes. This includes hormone therapy and provider qualities that are accepting and welcoming of transgender people. Transgender people on average. This is taking away from our interview recently with Cecilia Chung, and we'll be hearing about this next month during the webinar, but transgender people on average rank ARV access as their 5th personal health care priority, long after affirming care. Okay, so there's that. This is where I said before we can show our contact's name or not, show my agency name or not. This is data-driven. It's driven on the surveys that the transgender, why can't I remember the name of it? Transgender Legal Project uses. Various challenges. Provider culture, this is also from the survey. Provider culture prefers to stabilize patient HIV viral load first, but this is seen as rude and non-affirming care by transgender people, leading to a failure to link to care. They don't want to come back. Okay.
Now Michael's putting in the lessons learned, which is summing up those ideas.
Yeah. So in terms of the categories, this is a little bit harder because we want to make sure that we are getting them all. But what we're thinking about is probably outreach and out of care reach, because we want to make sure that we're affirming care. Barriers cataloging, because it's a barrier if a person is not seen as being welcome or, you know, receiving affirming care. And this is just all my sense.
The linkage as well?
Yes. Was linkage there?
I don't know if it's alphabetical.
Engagement.
Or engage. Yeah. And there's no limit on the number of categories one can select?
That's right. There's no limit. This is all based on your own intuition and your own feelings about this work and your way of thinking about it. So there we go. We've now filled in the entire thing, and I'm going to submit.
Content.
Content, please enter a longer post. At least 8 characters. Oh. On the this is the second part that I forgot to do, my friends. There's a second page. This work is based on the Transgender Legal Defense Group Survey in 2015. And what you can do is
provide a link to that survey document or the study information.
There we go. Do this. Like that. Okay. And we can also upload a file. And we'll talk about that in just a couple of moments. There we go. So click here to view our entry. We'll just go here to My Entries. And we can see right here. And if I was to click on this, it would take me right to the research. Ta-da! So that was kind of a quick and dirty way to do that, but this is something that we can show probably you know, again and again if you want to see more examples. I don't know if there's any questions right now.
What do people think about the ease of use, or do you feel it's challenging?
Hi, Judy. This is Chap. So looking at it, it really is a great resource. I have not had a chance to go in, but I will log in and just, as I learn more about it, definitely see what other communities are doing. I think it's a great resource. I like the fact that you can just link the journal article and then it just shows up, so you're not like trying to go to like a library, like the Maryland Library, and find it, which is really nice.
Yeah, it's really, really very nicely cataloged and much easier than the Dewey Decimal System, I must say, which shows my age.
Cool, and I have some stuff on the chat room that says, thanks for demonstrating how to post. I appreciate helpful hints. Absolutely, if you have any questions or concerns in working through this, registering and making entries, please let me know, and I'm happy to answer additional questions. There was another question about whether there's a specific web browser that ShareLab works best with. I personally have found it works great in Chrome, but I know other folks have said that it works pretty well in Internet Explorer. Internet Explorer was having some formatting issues, and so you'd have to click refresh after first going there. But I believe our web developer has solved that problem. Let me see. So we've just looked at Chrome. Now let's look at IE. Yeah, and it seems to be working well. Actually, it's working better here now than it is in Chrome because it wasn't jogging. So, you know, in terms of which one to use, I recommend either or. Our developer did our developer did develop it with the idea that it'll work in Mozilla and Safari as well. Okay. So I just wanted to take a moment, too, to kind of show you some of the other, see the way it bounced? It doesn't do that in Internet Explorer. I just want to show you something else that we can do that I think is really cool. I'd mentioned that there are comments, right? And I didn't talk about other features that are on this page. So this is once you're logged in. Once you're logged in, you can see more stuff here. And of course, I can go to see Nora, what her contact information is, and what all of her posts have been. She has a couple. But in addition, what I can do is favorite. I can also reply. It's the area where I can make my comments. For example, you know, at Garibo, I actually have found this same thing to be true. Check out this example storyboard I had put together. And then link, and then it's as simple as just linking that storyboard. You know, so I could link a storyboard right now. I can also do the same thing with a hyperlink. Check out this research that is in conflict with what you are proposing. Sorry for my fat fingers. You know, and you just paste it there like I did before. And then you can submit it. They receive an email that someone commented on their post, and they also have then anyone following that post also gets that comment. So we can start a conversation based on the amount of likes and you know, interactions and connections that we have between each other.
Michael, when someone wants to upload a document, can they do that in a response as well, just as they put in a link, or just
Absolutely.
put the verbiage?
You can upload a file and you can upload a link. Either way, as someone who's writing an initial post or as someone who is part of a comment thread that's attached to a post. A lot of us do similar work. So, you know, in terms of thinking about, you know, not reinventing the wheel and just kind of contributing to someone else's discussion, I feel that that's a really great way to save yourself some time and some typing, and also to make sure that it's clear for others who are looking for insights into a specific activity or approach that it's all in one place. But there's ways to navigate, too, by clicking around these nodes and by doing search and whatnot.
I think it's just excellent. And how might you translate this into something else that you want to use, perhaps to develop an abstract or storyboard?
Yeah, I think that that's a great question. We do have this template available for download. And in terms of thinking through what is on the template, so, you know, we have our
Enddisparities webpage.
Yes, under resources. You know, we kind of walk through. There's very similar things here as within the ShareLab itself. So what you can do is draw from other people's work in ShareLab to create a storyboard like this. You know, there's different versions of the template depending on color and what formatting you like. Or you can kind of go the other way and take something that you've presented at a conference that's like this and then just type it into ShareLab as a way to further disseminate that work. Both the idea of presenting at a conference and the idea of putting material into ShareLab is to get your good work out there and to make sure that the work that you're doing doesn't end at your own walls or within, you know, the borders of your own mind, but can, you know, kind of cross boundaries huge geographic boundaries and other types of boundaries that, you know, kind of keep us separate.
I still remember the days of having a three-part fold-out with having to dry mount poster to the, you know, the board and carry it with you if you wanted to share it with somebody. So this is really a great way to do it easily and also to, like you said, get it out there.
Yeah. To me, this image really stuck in my mind when I saw it years ago, you know, but it really has affected the way that I think about things like ShareLab and, you know, our social media work and dissemination work is that, you know, we have that blue bubble on the left that we create a lot, we do. Our hands, our hearts, our minds are big, and they're constantly busy. But unfortunately, we're not always very good, especially in HIV, about getting that story out there. And so the world doesn't see very much of what we're doing. They only see the things that are in their face or readily apparent to them. And so the impact that we have is very limited as a result. Within our own setting, our impact is larger because more people can benefit from our great activities, and they see and understand and acknowledge our great activities. But in terms of thinking within the broader ether, you know, or structure, our impact diminishes because there's less of that, you know, visibility. And it's amazing when we think about how that drop-off, you know, just inside of our walls and outside of our walls, you know, how significant that drop-off is. In New York State, we're focusing a lot on ending the epidemic by looking at the arrangement of provider organizations and non-traditional partners within regions and thinking about those places of worship and the Jewish Community Center and after-school programs and continuing education programs and all of the different things that people interface and interact with, you know, that would have no idea what you're doing within your center if you weren't, you know, actively going to them. You know, that's the concept here, is that we want as much of what we create to be visible and talked about in the broader, you know, structure like the ether, just so that we can have a greater impact.
And I think conversely, for those that need it to stay within their four walls, for instance, using that template really is a shortcut and would be very helpful to post a story that you want to share with your board or with your QM executive committee or even with consumers. It will allow you to do that as well. It doesn't have to go to a HIV conference, although it can. But again, it's a very good snapshot, condensed version, if you will, of the work, the outcome, and you know, you pat yourself on the back if more people are able to share what they're doing. Even from my experience working with grantees or sub-recipients, you know, that it would be nice to see more postings within their facilities highlighting some of their work.
Mm-hmm. So we have about 10 minutes left. I'm wondering, you know, what other reactions or questions folks may have? Is anyone planning on putting together a project based on their work on ending disparities that could then become a poster or a presentation? There's a huge list of conferences, you know, that touches HIV or quality improvement that are appropriate and probably would really welcome these types of presentations. What are some other thoughts of folks on the line?
Well, this is Bobo. I think I'm probably going to end up using it in-house first. It's given me a great way of disseminating various QA/QI teams within our organization. So I'm going to try in-house first.
Cool. Thanks for sharing that. You know, especially listening to you, your system is spread all over the place, and that's a great idea to kind of bring people together virtually within, you know, a different setting. That's a great idea.
Right. A lot of places, you know, have share drive within their system and, you know, can place something like this there and let other entities in their network see it as well.
Hi, Deanna, by the way. How is Oregon today?
Hi there. Oregon's good. We're kind of a little snowed in, but nothing compared to back east, of course. We plan on using this more so as well, kind of within our own system. We're going to be partnering with, because we're Part B, we're going to be partnering with Part A to do more of a statewide, use it as a statewide kind of a QI initiative. And then also just to help our subrecipients because they kind of struggle, especially our small county public health departments, to know kind of like how to start off small with a little QI project. And I like when I looked around at some of the examples, some of them are just like very simple, like running a loss to follow-up report and how do you follow up. So I think it's good for them to actually see it and see that it doesn't have to be some huge overwhelming project. Just document what you're already doing to start.
Amen. That's right. You know, we can save our SAS tables and all of that for later, you know, or buying an expensive package or an intervention for later. Start simple. Amen.
Right. There's no reason that you have to say, oh, I can only put something into ShareLab that's an advanced, fancy, you know, multidisciplinary kind of intervention that was, you know, really high caliber, if you will. Not that, you know, you can put something simple in and there's an audience for everything. You know, there are small agencies and there are new agencies and there are new people and lots of turnover. So these are good tools for them to use and resources, just as the NQC web page itself has the Quality Academy. This is just one other avenue that you can utilize.
I have to say, though, it is, you know, for smaller programs, it is a little intimidating to think of kind of putting yourself out there, because I think that there is this kind of unspoken and sometimes spoken fear of being judged in the QI community. Yeah. And I don't know where in the heck that ever came from, but I think it is important to kind of acknowledge that that, you know, really is the case for a lot of folks, including even myself feeling intimidated about putting stuff in writing. So I do appreciate seeing, you know, the more you look into the examples that are already there, I think that the more it kind of eases that fear.
Yeah. I agree with you completely, because I felt that way too. Like when I was in the field, I was like, I'll be the second person to submit.
And I don't think you really wanted to go in and label things as beginner, intermediate, or advanced, because it might discourage people from reading things that are, you know, are there, and until you get into the meat of it, you're not going to know just how involved it was. It could be a longer narrative for a very simple strategy based on the way a person made the entry. So that's right. I think it's great to fish around in there.
Any other thoughts or comments about this? Well, as they say, sharing is caring. What was that?
I'm just wondering if people think that this was a helpful discussion and really gave you a more of a degree of comfort of how to utilize ShareLab and abstracts.
Actually, I think so. It's going to be very helpful. I just wish that more folks that are doing what I'm doing in our area, you know what I mean, Judy, we're a part of this call because, you know, right now we're traveling back and forth between us and McGregor, sharing information. You know, to be able to do it electronically without burning gas is another good thing, too.
Yeah. Well, you know, McGregor has a couple of posts that are in there from the In-Care campaign days, and so maybe working with Sharon to see if it's possible for a member of the team to take over that account and to just kind of shepherd and manage that, you know, might be an approach to take there. But yeah, I definitely agree with you, Robert, that that's a way that we can leverage and streamline our regional group work too within regions. I think that that's an awesome idea.
And maybe even we as coaches can reach out to our folks in our portfolios and just remind them of ShareLab's existence, and if they've updated a project that they may have forgotten they put in there 2 years ago, just give them a little nudge as to what's new and what would you like to share. We'd love to hear more about it, and or something new, and just encourage the continuous supply chain.
Well, thank you so much for joining us today. I think that it's always helpful for me to kind of get a sense from folks in the community, you know, whether or not our tools are timely and also value added. And I feel more so than ever that this tool is a timely tool for the types of things we're trying to do right now. And then it does add value for our programs in a number of ways, including leveraging time and resources, and also making sure that we're more impactful ourselves in terms of getting our word out there, which is really the purpose of today's call, is to talk about opportunities to share our own good work. And we'll be coming back to this topic and hitting it hard again in May and June of 2017. But we didn't want to, you know, just kind of leave it to the end. We wanted to get people thinking toward the beginning of this initiative as well. Like, what are the things that we have in our toolkits to really sing our song?
I concur.
All right, everybody. Have a wonderful rest of your day, and thank you so much for all you do and for your attention today on today's call.
Thank you.
Thank you, Michael.
Bye, everyone.
Thank you. Bye-bye.